Hi, this is Lisa with Fitness for Paws Health Promotions, providing wellness solutions for man's best friend. And what you're looking at today is the skeleton of a dog. And we've got the head right up here. And what we're going to talk about is intervertebral disc disease, IVDD, intervertebral disc disease. And I chose to talk about this today. I had a friend whose dog is a dachshund, and had an episode of IVDD. So I wanted to review what it is and how it is treated. It's a degenerative condition that causes compression of the spinal cord and spinal nerves. Obviously, people are upright and our spinal cord is this way. Dog is in this orientation. You've got the spinous processes, and then it's hard to see the discs on this particular skeleton, but think of the disc and the human are stacked one upon the other. Same thing with the dogs, but in this orientation. In the middle is the disc. It's the cushy material that provides cushion and ability to move smoothly, prevents compression and shearing with movement. What happens in the degenerative conditions is this disc material starts to push out into this fibrous cartilaginous ring, and then it starts to push on the spinal cord, spinal nerves, causing pain, weakness, other symptoms. So the breeds mostly affected by IVDD are dachshunds, are very high on the list, but other small breeds such as Pekingese, your Frenchies may have that. You might see signs with the smaller breeds, and as early as 1 to 2 years, and then the larger breeds, it's generally over 5 years that you might start to see symptoms. There was a research project that showed, unfortunately, that breeds such as dachshunds may show degenerative changes in the spine as early as a few months of life, and they were led to conclude that that was probably a breeding issue, that those signs were seen so young in life. So that's obviously a concern and something to think about. So when that disc material starts to push into out of that fibrous ring and hit on those spinal nerves and spinal cord, the dog's gonna have symptoms of possibly pain, ataxia, not able to walk, weakness. Some of those signs, and resulting in that they may not want to eat, just lethargic, inability to move in a quality movement. So you want to get the dog to the doctor as quick as possible to see what the degree of injury is. They may prescribe medications, some anti-inflammatories, and usually conservative treatment would include cage rest and the anti-inflammatories. And something to say about cage rest, it truly is cage rest, where they're in the cage for quite a bit of time. You want to provide a lot of padding so that they're not getting some pressure areas from laying on parts of the crate that's causing some discomfort because they may not be moving as well. You want to make sure you keep that crate clean, that they're not laying in their own urine to get urine scald, again, risking the issue of pressure development, pressure sores. You don't want to have them doing a lot of movement. Definitely no jumping, no turning, pivots, those kind of things. When you take them out, you're going to take them out on leash for potty breaks. So it's going to be very brief walking, nothing extraordinary in terms of movements or anything like that. And that's because you don't want that disc material to continue to protrude any further than it has. So that's kind of conservative management. They're going to work on inflammation and pain. Now, if it's a more severe case and the dog is not able to walk at all, they may consider surgery, such as a hemilaminectomy. In that case, they're going to just clean out that disc material that's pressing on that nerve. And post-surgery, obviously, you're going to deal with the surgical pain, surgical inflammation, and slowly progress them back to function, which may involve rehab. So there's going to be a certain position protocol to return them back to activity. But again, it's going to be very limited in terms of, you're not going to want quick movements from side to side until the healing process is at a certain level, and then you're going to progress back to normal activity. The concern with IVDD is what we call an absence of deep pain. A dog that has symptoms of IVDD, such as the inability to walk or paresis, either weakness or total inability to walk, is that if they do not have deep pain sensations, that it results in a poor prognosis. So those are definitely going to be some dogs that you're going to be surgical candidates if they do not have deep pain. So if you are, at the feet and you are, they typically use like forceps to pinch the toes and somehow try to produce pain there at the lower hind limbs. And if they're not able to, that sensation loss of deep pain tends to be a poor prognosis, but don't take that as no hope at all. It just means you're going to have to do some more aggressive treatment, probably, definitely the surgery, and then going from there with rehab. And rehab, again, can include exercise for balance, strength, modalities such as laser, electrical stimulation to stimulate weak muscles. If there is a facility nearby that has an underwater treadmill or a pool, aquatic therapy may be indicated. So having pain is in fact a good sign when it comes to IVDD, because it means those neural tracts are intact for pain sensation. The dog's spinal cord, like I said, their spine is a little different, obviously, than ours because it's in a horizontal position. The numbers are a little bit different. The cervical spines, C7, T13, lumbar is 7, and then this poor dog, he doesn't have his tail, but the tail, they can have as many as 20 vertebrae in the tail. And what you'll notice with the thoracic vertebrae is they have this orientation, which we call a caudal orientation, because they're going back towards the tail, and then they come back this way. It gives the muscles something to hook onto for pull. And then your lumbar vertebrae, they have a cranial meaning head, cranial orientation, that they're coming up this way. And usually it's at about a T11, it's probably right in there, is where you can actually feel it on your dog. If you palpate, you're going to feel, and there's going to be a spot right there where it's neither going this direction, caudal, nor cranial. It's going to be almost spot up, and you can actually feel that on your dog. It's usually at the thoracic level T11, and it's called the anticlinal. So that is a brief overview of intervertebral disc disease, very brief, but just gives you an idea of the fact that your vertebrae are similar to ours, and that we have cervical, thoracic, lumbar, down to the sacrum, and then they have the tail, which has additional vertebrae. They're in this orientation, but the same concept of when we have a, quote, slip disc, bulging disc, is that disc material is pushing out of that fibrous ring and irritating those spinal nerves, and it's going to cause motor problems of weakness. It's going to cause sensory issues of pain, and like I said, the presence of pain is good. The absence of deep pain tends to be a poorer prognosis and more indicative of a need for surgery. So that is today's brief overview of intervertebral disc disease.